Titiyal sir is the Chief RP Center AIMS New Delhi and the Vice President All India Ophthalmic Society. Sir is going to give us some ideas how we can have a structured curriculum or increase that in there. I request ma'am to please join. Sir, ma'am, please join. Sir.
Good afternoon, chairpersons and dear colleagues sitting here. I think teachers are not only teachers, the students are better teachers because they are the future. And I just listened half of talk from very I think one of the best teacher I've seen for society-wise. It talks about all the basic aspects. But is there a possibility for us to modify, enhance the curriculum which is there in our country? And that is what I like to stress my point on some of the areas or these areas. And then these are basic postgraduate courses which are there in the country. So basically, it will be MSMT, which is a 3 years duration course in our institutions. Or you have a diploma, which is DAT now. And DO is 2 years, it's a shorter course. I think that requires a further enhancement by doing some other supplementary courses also. So basically we have MD, MS and DNP, which are major areas of concern. And as institution-wise, we have a government institutions, which may be a medical institutions, universities. State governments have their own universities and medical colleges. Then we have a huge, major area of sources for teaching is private university medical colleges. If you look into autonomous bodies which are not under the NMC, they have a different output in terms of giving a good teaching to their students, because they normally would look into NMC guidelines also. Also, they'll put their own ways to enhance the teaching for postgraduates, depending on our institution's requirement and placement also. And normally these are having a larger patient volume, because patients are one of the best teachers for us. But unless we have a patient clinically, surgically, then how can we impart the teaching for our students? I think that is one area we have to look into. And other area which is important in these institutions are, they have their own ways to institute teaching curriculum, own ways to look into the research aspect of these students. And these institutions have done well. So they are basically an institution of national importance. And second important area which has a larger medical universities and colleges are state areas. Unfortunately, most of them have not gone into a proper enhanced ophthalmic institutions, because most medical colleges will have a department. And today, department is not a sufficient area for imparting the future way of taking care of ophthalmic teaching and training in these areas. So we need to have more enhanced departments which goes into upgraded departments, or they become RIOs. And there's a restriction of RIOs. You can't have many RIOs in the very states. So maybe you can have upgraded department in these areas to enhance the teaching of our students. I say this because once you go through the examination process of need, the many students who qualify in the higher grades will opt for these medical colleges because financially it may be more suitable for them. But unfortunately, after 3 years, we don't make them our best possible students. They struggle to get into other areas. So we have to enhance these state areas. Private universities, they do have norms required for NMCs. They are doing very well. They have modern facilities. In fact, some of the universities have, colleges have everything possible, which in a government sector may be very difficult to acquire them and give exposure to their students also. And there are private institutions which are only for ophthalmic institutions. They have one deficiency there. They have a very nice ophthalmic center, but may not have the other departments attached to them. That is like presumed neurosurgery, neurology, cardiology, which also should be integral part of our teaching of our medical students. That will be a postgraduates also. So these are basic guidelines for NMC. I have put into 2 different objectives here. Basically, as we said, like there has to be uniformity in the PG teaching curriculum across the country. Let it be government sector or a autonomous body or a universities, private. They should have a proper uniform standard PG courses. We should focus on a enhanced curriculum, training, assessment and research part. And these are four important aspects which will be covered in a very modular training structure, which is a structured modular program, and should look into a clinical aspect, theoretical research, and effectively have elective postings also to different sub-specialty of population. So these are 4 or 5 areas of concern which is we're going to look into future-wise, and these are areas where training is done. You see clinical is major area, surgical, wet lab training, research component, and these are 2 important mandatory parts for students which normally the government setups are not carefully taken also. Maintaining the attendance, which is a major challenge for today's student generation, which we can't really impose for very such classes also. And second important thing which we miss in many areas is logbook maintenance. I think that is one important consideration should be given to all PG programs. The other area which we are looking for are at least minimum standards in the teaching area, the training areas. That is infrastructure. So you have to have a good OPD, OT and lab services, which is focused into our equipment, which are up to date, recent, and they're applicable to a current day practice for a patient care and research. Apart from that, patient load is very important. And the most important part in the teaching area is faculty. You need to have enough faculty as per the ratio. Our student versus faculty ratio should be there. And you should have right from the HOD to a professor, additional or assistant professor should be adequate in these cases. And they should be well qualified and they should be up to the mark. But then the question comes here always, should we have accreditation for our teachers also? So maybe that is also an important area for a future to look into how the teachers are doing in terms of effective translation of their knowledge, their skill to their students. And the other area for LMC guideline is to have an assessment, that is the examination of these people. The one can be formative assessment, by a skill assessment in these cases, and look for other areas of practical examination combined with theory, which may be OSCE and Viva in these cases also. So these are the various challenges I thought which is there in our teaching programs. One is there's a lot of information overloaded in our social media, which may be Google, which may be ChatGPT. So that is also causing a lot of stress to teachers and students, and the combination of atmosphere which is happening in classrooms. Motivation, decrease the motivation of students because we can't really give them something beyond which is available in the media. Today, if I say, okay, I'm going to take a class on how to do FACO, the student says, I can see 100 videos in those 1 hour. Why should I come to your lecture? Where you're going to say something which is sort of from your side. I have views of 100 surgeons I can see there. So you have to look into that to how to get beyond that also. Classroom engagements has to change so that they come to class, and assessment challenges are also there also. So these are 6 areas which I'm going to take you through, how we're going to take. In terms of theory-wise, I think this is what we have been doing, classroom teaching for all these people, and the challenges have come, which we have to take beyond the, the knowledge they get to the internet. So we need to have interactive sessions. At the end of a session, you need to have a quiz or an MCQ so that we know that what they have gained after your class. Maybe you have a lot of video-based or simulation during the actual theoretical classes also. And these symposium seminars should be done by students, and the preceptor can be there also. So this is one area we have been focusing for last so many decades in the AIIMS, where a group discussion is a major part of PG teaching. So we have first semester because we get 2 sessions every year. So we have semester systems, and we have 6 students in 6 batches in one particular group. By maybe multiply 2 or 3 students in each group. So you have a group of 10 or 15 students, and they are the people who discuss the particular case which is being presented next day, or a journal club, or any presentation, your thesis presentation, protocol presentation. Everything is discussed beyond the normal routine class. And they are normally supervised by either the senior most resident doctor of their batch, which is labeled as a group leader, or it can be a senior resident immediate to them, or a faculty can be also labeled. Once I took over in the RP center, I made faculty in charge for these groups so that he or she mentors these people better. So it's a very effective way to disseminate the results very faster. And this can be one way of improving, discussion amongst the students also. Clinical training is also is a challenge nowadays. How do we enhance the actual clinical training? I think yesterday only I was in one of the webinars where the skill has to be discussed. So I said we have an advantage, the older people, we had a very nice clinical skills by examination. Today if I say just see the fundus, they'll take the patient for a fundus camera and take a photograph. So I could do a nice fundus examination, take out all the points, draw the diagrams, and that is a skill we have. Maybe that's still advantageous. So this is one-to-one teaching to your students. You have a group teaching, and bedside teaching is still one of the important areas in the RP center where we have the 3-tier teaching happening these cases. I think this is the one area which is being missed now, because most of the services are shifted to daycare services and hardly any patients are there to be seen. If today a patient is admitted for surgery, we don't know what is to be done in those cases, because patient comes daycare and surgery done, patient goes out. I have no knowledge what surgery, how the surgery has been done by my student. So this discussion is very, very important to generate the enthusiasm amongst the students and carry forward the training between the teachers and students. Have a very nice composite, comprehensive discussion on a patient's care and outcome-wise also. In fact, in our days, we used to have one day, Saturday afternoon, the whole week's assessment of patient admitted and discharge and rediscussion among the group of unit also. Record keeping should be important, and as far as surgical training nicely covered, I will not go in detail with this, but these are important areas which should be covered in surgical training also. Competency is one area which should be taken into. This is how we do it, and nowadays we don't allow a student to do a live surgery on a patient. They have to really get wet lab training, certified that he or she is now competent enough to do all these steps, then only they can do surgeries. And that to a supervised surgeries, assistants, then the individual surgeries are done in these cases. In fact, we have now wet lab simulation in a court site for any type of surgery possible, and wet lab training is an important component part of PG teaching in every institution now. And now OT teaching has also improved now. Once you have these other devices, digital devices, larger screen, people can sit inside the students and see what is actually seen by surgeon in the 3D picturization by the other people also. This is, I think, briefly touched about thesis. This is one area which I like to highlight here. This financial grant is very important for our PG students. Either it is for your institute where a student is there, or for the other institutions which can support that. AIOCMT does give award to around 50 theses. This is a 2-3 years down the line. This money has also increased now to 50,000 rupees. At AIMS, we are supporting a large number of students for a PG thesis writing and the other important investigations which are required for doing a better thesis in these cases. Today you have to do a cytokinin studies for a dry eye and require at least 10 lakh rupees for that. Otherwise you can't do it. So that type of support should be there. Every study should be having a CTI registration, and there should be a publishable thesis work so that the student gets something out of that also. This is, I think, very, very important areas to look into. Mentorship is very important for all of us. In fact, I remember my younger days, I was going through my own days of my MBBS days. We used to have one faculty mentor for a group, and that faculty used to take care of 4 or 5 students for all the functions, and that would give you a much more healthy atmosphere for all of us. I think this is one important area. Accreditation, certification of institutions who are imparting these postgraduate teaching is very, very important. If not NABS accreditation for an institution, the MAC accreditation is also very, very important for all institutions to be done in these cases also. These are few important things which should be added into our teaching areas. Apart from the routine, the theoretical, other teachings, medical legal aspects should be a big aspect in the teaching curriculum, and the management part also. Because these are people who are going to become actually expert future, and then suddenly you require to do a management. So maybe some classes by MBA people or a hospital management should be part of these cases also, and all these things should be covered. And this is what is important to enhance your area, divide your entire services into multiple specialties so that students go to each area and get enhanced training in these areas, develop research labs, have up-to-date structures which can impart not only the basic areas of research, also the surgical training, other areas should also be there. Infrastructure has to be upgraded every few years. You can't sit down in your institution that we have everything. But I know that OCT today, which was 10 years back, is not truly a good tool now. You have to have a different thing. The upgradation of these services with the rapid advances should be there in these cases. OT services also. I-banking is another area which many institutions don't think of. PG courses running areas should have I-banking as a compulsory part, and the students should also be part of the area also. I think this is the future. The emphasis on technology has to be there, advanced technology, integration of AI, telemedicine, virtual simulation can be part of our future programs of teaching also, which will take you through various areas. And one thing we are missing in India, we lack, I'm not talking about top 20 institutions. There are another 100 institutions where they don't think of a collaboration with the global institutions, because that horizon has to be changed for our students and upgrade your teaching methods as per the changing norms in a global pattern also. Allow your student to do publication from their thesis work, from their cases which they work every day, what type of symposium seminar they are doing that can be taken into a sort of a review articles and send them to our conferences, national conferences, state conferences, international conferences, and you can see that societies are helping there. If you look into our state societies, look for AIOS, we are supporting students for international travels, international fellowship programs. In future, I'm pretty sure ARC will look into that to cover, if not 100, maybe thousands of people going across the world for various areas. To summarize the 6 important areas for future, I think comprehensive teaching have been done very, very effectively by a fellowship program for super specialty trainings, running your own enterprise in future, and that aspect should also be covered in the PG teaching courses. How are you going to survive in future, having a better professional attitude, and the 6 important areas looking to be a good clinician, be a good surgeon, be a good teacher, and be a team player. I think all these will make you a very good ophthalmologist, and future direction should be in that way where you have a comprehensive educational program, prepare them so that your students can handle the current area of patient care, teaching, research, and also looks for future directions also, because they are going to see the future and they are going to build the future also. Thank you for kind listening. And
thank you, Titiyal sir. It was very comprehensive and very I would like just to, because you are one of the senior most person in the country, sir. One suggestion I always think upon one idea I have got, that why not select institutions? They now start going for MCH retina, MCH pediatric ophthalmology, because the whole load is on 3 or 4 south institutions. And every good institution can start it. Sir, the problem what we are facing as a medical college nowadays, as for example, I was discussing with sir, it's one of the oldest institute in the country. Now what is happening, sir? With Ayushman, catered patients are not coming to medical college. Previously we had 10 PGs, now we have 70 PGs. Teachers are saying, no cataract is coming. They are all going for Ayushman, private practice. So in these challenges, how to face these challenges and how to improve ourselves?
I think I didn't go into a super specialized training, but that's a different areas. And today, almost 95% of super specialized training in the private setups, like people like Arvind, LVP, Sankara, and Chitrakoot. The government setups are doing a different type of training in those areas. In recent times, in last 5-6 years, there has been a definite focus on to start super specialty training in the government setups also, especially in the autonomous bodies and RIUs. The PGI Chandigarh is one of the first institute to start MCS. They have it cornea, refractive, retina. They are expanding in other areas also, and AIMS New Delhi is very soon going to have 8 areas of ophthalmic field where MCS program is going to come. And some of the RIOs have also started, like Bangalore, they have started refractive surgery. Calcutta, they recently applied for a MCS program. So this is going to be a feature for future also. But as far as cataract training is concerned,
So what is happening?
institutions, just we covered the last point. Institution where patients are not coming, the one benefit of peripheral reach out programs, that is doing peripheral centers, which has to be taken by the government colleges also to have a peripheral centers where your student go and attend those areas, get the patient from there. That has to be worked out because patients are not going to come to your institute now. We have to go them and get them to our institute, and that is a new mantra. Like the going to the patients is to bring them to institute is the way of future also.
Thank you, sir.